how to release the main trigger points in your piriformis coming up. Piriformis is a muscle that gets blamed for a lot of things. And yes, it can get tight. Yes, it can get sticky. Yes, it can get stuck. Yes, it can cause some sciatica types of symptoms. And if you know that your piriformis is really locked up, or if you're not sure and you want to do a quick release on this muscle to have some relief, maybe you have aching in your butt, aching down the hamstring line, I'm going to show you really clearly how to release piriformis. And I want to say that a lot of folks who have a turning out, an external rotation of the thigh and the hip, and they look down and you see that one foot is turned out while the other one's facing forward, most people are going to say, oh, that's piriformis. Well, maybe, right? But maybe not. So I'm also going to show you a quick little release of piriformis's 6 best friends that are also external rotators called the deep 6, and that's going to feel really good. So we're going to release piriformis. We're going to release those deep 6 lateral hip rotators. There's some other muscles to play with, but this is going to get you really far in your piriformis relief. To release your piriformis, you're going to need a clear space at a wall, and you're going to need these 2 balls. You're going to need the soft free body ball. You're really especially going to need this soft ball because if your piriformis is really jacked up with tension, and especially if it's doing any pressing on the sciatic nerve, a smaller, firmer ball is going to be too much and might actually aggravate that nerve sensitivity and aggravate your symptoms. So you definitely want the softest ball you have. Hopefully you have one of these soft free body balls because this is really the best tool. Then once some of that sensitivity has gone down, then you can use the small myofoam ball is my ball of choice for this practice. So free body softball, small myofoam ball. Let's go to the wall and release that piriformis and the deep 6 lateral hip rotators. So I want to show you where the piriformis lives in the body and how to find it. So here is the sacrum bone in the center of the 2 sides of the pelvis. And then here on the outside of the hip is a hard bony nub. That's the greater trochanter of the femur. So the piriformis goes from about the mid-sacral area to that greater trochanter of the femur. And so yes, it does externally rotate. Most of the time it turns that femur out like that. So to get the 2 points, there's one that lives right at the edge of the sacrum and then one that lives right behind that greater trochanter of the femur. Then we're going to go down and get into those other lateral hip rotators that follow deep down below that line. So we're just going to kind of clear this whole back of the hip joint. So we're going to start with that soft free body ball. You're going to bring your back and your butt to the wall. And then notice that what's resting against the wall is that sacrum in the middle of the 2 sides of the pelvis. We're going to start by taking this ball and putting it just to the right of the sacrum on the right side of the body. And we're going to stay kind of facing straight out toward the center of the room and go up and down along that sacrum. It should feel gentle with this soft ball. You want to hydrate this tissue. You want to not freak it out by going too firm, too deep, too fast. You will have trouble clearing the tension if you're shocking your nervous system with too firm of a ball. So we're just going to go up and down along that sacrum. And then you're looking about halfway down or just an inch or 2 from the top. Often there's a little tender spot in there. Now I'm going to rock a little side to side. I'm going to see if I can rock all the way out to that greater trochanter of the femur. When I get out to that point, I feel my body is holding that trigger point. I'm not feeling my body holding that inner trigger point, but yours might be holding trigger points on both sides. So I'm going side to side. And then if you're using the firmer ball, and put that soft ball down, if you're using the firmer ball or if you've warmed it up now with that soft ball, Now as I get into along that edge of the sacrum, right where that piriformis lives, again, just an inch or so down from the top of the sacrum or halfway down. And you can go up and down along the sacrum. See if you can find that tender spot in the middle. That tender spot in the middle is along the sacrum is your piriformis. So I'm going to sink into that spot. If it's too much pressure, just step your feet in closer to the wall. If you want more pressure, step your feet away from the wall, and that's going to sink your body weight more deeply. That just got a little too much. So I'm going to step in a little closer. That got real exciting there for me, so I'm going to step in a little closer. And just maybe a little wiggle side to side, gentle pressure there. And breathing in your belly always. Couple breaths. And you can hold on here, 3, 4, 5 breaths. You're not going to want to hold too much longer than that. You can take micro movements, micro bends in the knees, maybe going up and down, making sure you're getting right on that most exquisite spot. Notice I turned my body just slightly to the right, so I could kind of trap that point against the sacrum. So we started straight on, going up and down, getting that warmed up, and then turning a little bit to the right, now really carving along that edge of the sacrum. Now that's plenty of time there. Now I'm going to just slide that ball out so that I'm right behind the hip joint, right behind where the femur dives into the hip. So that's pretty far out there. And when I go up and down along that area, at the top of that hip joint, so here's the sacrum, now I'm out here, and I was right here next to it. Now I've migrated over the outside attachment or the lateral attachment of the piriformis, and now I am going up and down there. So you're going to do this on the affected side. Often piriformis is not a bilateral issue. It's usually one side or the other. So we're just going to treat this one side. That feels so good. And I'm going to kind of wiggle on it. I found a real tender spot by just gently going up and down here. You might find more tender spots up high. That's gluteus medius. That's another treatment altogether. And really, wherever you find a tender spot, I want you to breathe and sink and relax your body. Relax your jaw. Relax the rest of your body. That's going to help your body receive that ball. It's actually going to go in a little more deeply, and it's going to help that piriformis to relax for you. So now I'm just going to cruise along the line of the piriformis, rocking the body side to side, cruising along. And then to finish our treatment, we just want to give the deep 6 lateral hip rotators a little bit of attention. So you'll see me bend forward a little bit. That's going to kind of open up that space for the ball to go behind the femur there and up to the piriformis. Oh, it's so exciting. You do need a smaller ball, like a small myofoam ball, to get in there because they're deep and it's real specific and it's a small space. So you just want to be kind of sweet and gentle. Stay close with your feet to the wall. And then one thing you could do is just kind of wave your knee side to side. This external rotation, internal rotation, external rotation, internal rotation. That's going to kind of wave it under the ball. Ooh, so exciting. Bending over a little bit, kind of opening that door right there. Whew. All right. And then when we're done, we're going to do that really famous piriformis stretch at the wall. So bringing your hands to the wall, you're going to step back from the wall a little bit, bend both knees. Okay, and then I'm just going to move my hand so that you can see. And I'm going to bend. I was working that right side, so I'm going to stretch the right side by crossing the right ankle over the left knee. That really famous figure 4 piriformis and lateral hip rotator stretch, right? But here's how we're going to do it differently. You're going to push that right ankle into the top of the left thigh. I don't want it to be relaxed and yanking on it, right? You're really engaging that actually sends a signal to the nervous system. The tissue's not going to tear, and you'll actually go deeper into this stretch. So at the wall, hands to the wall, right ankle over the left thigh. And then the more you bend that standing leg and the more you stick your butt out behind you, the kind of deeper into those hip rotators you get. And you could walk down the wall, down the wall, down the wall. Feels so good. Pressing that right ankle. Your stretch might just look like this, right? Over time, you do that release at the wall with the balls, and then you come into this stretch. It gets better and better every time. Just taking another breath here. Right? And then you're going to release and come up to stand. So you release your piriformis and the deep 6 lateral hip rotators. That's great. I just want to remind you to do that gluteus medius release video too. Gluteus medius has a strong pull in external rotation, so it facilitates that movement that the piriformis makes, and it might keep pulling your piriformis back into a dysfunctional tension. So treating that gluteus medius, doing some gluteus minimus, maybe even a psoas release, which also can be an external rotator, would really facilitate. So take care of your piriformis, take care of your external hip rotators. See you next time.